Hi everyone, and welcome to this presentation about providing nourishment for your body with nausea and vomiting. So my name is Amber. I'm a registered dietitian nutritionist, a board certified specialist in oncology nutrition, and an online nutrition coach. Today I want to talk to you a little bit about food strategies that you can use when you're feeling unwell, when you don't feel like eating. Perhaps you feel like you have an unsettled stomach and you want to obviously still provide nourishment for your body. I want to give you some tools and some tips to help you do just that. So what I want to talk with you a little bit about first is some of the food strategies that we use in order to help you eat a little bit better while you're not feeling well. So the first thing we want to talk about are the food ideas, things that we can do to help our bodies process the foods a little bit easier, and then also foods that work better and foods that don't work quite as well. So as you'll see on this list here, the idea is we want to provide mild, easy to digest foods for your body during this time. Now, hot foods, things that have strong odors to them, can sometimes set off that nausea. So what we want to do is use cool foods, cold foods, room temperature, light kind of foods to help ease that stomach. So fried foods, greasy foods, heavy foods, rich foods, they may not be very well tolerated right now. So keep that in mind as you're choosing some foods throughout your day. Also, keep in mind that it's easier for your stomach to eat smaller meals more frequently. So that may look like 4 to 6 mini meals spaced throughout the day. Yes, it will feel like your eating is a full-time job, and it kind of is. But your eating is very important for your treatment. You want to be able to keep your body nourished and with enough energy to help you heal and recover during treatment. So it can also be helpful to avoid or limit the amount of beverages, drinks, liquids, things like that that you would have with your meal, because they tend to take up space in your stomach. So we would want to pretty much just use those sort of drinks, water, broth, juices, things like that, to help get the food down if that's necessary, but also put those between your meals. Set timers for this kind of stuff, because it will feel like you're doing something probably every hour or so. So if you're having, let's say, 4 to 5 small meals a day, chances are you're going to be eating something about every 2 to 3 hours. It may take you a little bit longer to eat as well, so that also is factored into that time. Plus, if you need to stay hydrated, and that is important during treatment, you may be having something often. So setting a timer, having a schedule, that can be very helpful. So the next couple of slides, I want to provide you information about foods that can be helpful when your stomach is feeling unsettled. And this dry food list can be very helpful, usually that first thing in the morning if your stomach feels unsettled getting up. It's a nice food to just settle the stomach. It can be helpful with medications as well, because again, it's just something light and small in your stomach that can help ease some of those side effects from some of the medications that can cause nausea. So ideas are crackers, toast, dry cereal, breadsticks. Just think of any of those dry foods that maybe when you put them in your mouth, they kind of start breaking down a little bit. Easy to use foods. The other one's just bland, boring kind of foods. Nice, basic sort of foods. So I've listed a couple here, and sometimes they'll sound doable and workable. Sometimes they don't. That's okay. These lists, they are not complete. They are not exhaustive, meaning this is just to give you ideas of things that you can do. But mashed potatoes work fairly well because we can add a lot of stuff to them if we need to. So let's say your basic mashed potatoes, you can fortify that. You can add extra calories, extra protein to that by mixing, let's say, Greek yogurt into it. You can mix in cottage cheese. If you don't mind the texture, that's a really great source of protein too. I've had people mix in cream cheese, butter, anything like that to just up the calories and make that a easy food to get down and pretty easy on your stomach. Now again, if it's too rich, you'll know. Like, you'll be the best judge of your body though. So the information here are guidelines. You are the person who can experiment with these and see what sounds good, see what you can add to add some of those extra calories and protein that you may need right now to these kind of basic foods. Eggs across the board are a pretty neutral sort of food. They tend to be pretty easy to get down. We can change the texture of them. So let's say we can have them soft scrambled, you can have them fried, depending on where you're at in treatment. If, let's say, you're neutropenic and whatnot, having that runny yolk, we might want you to make it more of an over medium or over hard. But still, eggs are a really easy way to get a lot of protein and some calories in, and we can always add things to them like slices of avocado, cheese, stuff like that, to make them even more heavy in calories and protein, which you might need. Pasta, keep in mind the sauce is important in this part. So with nausea and your stomach's not feeling very settled, this is a very personal one. So I've had people do very well with a light oil, so an olive oil, avocado oil, something like that. But keep in mind that, that may feel too heavy too. So adjust the dose of what you do with that. Sometimes marinaras work well, but the acid from that sometimes doesn't go over well. This again is a very personal sort of choice. So finding something that works for you would be a great idea. And then again, like I mentioned before, cold foods don't have as much smell. And when you are nauseated and you don't feel like eating, sometimes that smell can really trigger that. So we're talking naturally served cold foods. So egg salad, chicken salad, you could do salmon salad, pretty much any of a protein and some sort of creamy fat, like a creamy avocado or a creamy, like a mayonnaise or something like that, works very well. If you can do the crunch and the texture and things, you can obviously add other things to it. But if not, just focus on those two ingredients in there, and that'd be very helpful. And then things like even cheesecake, yogurts, cottage cheese, things that are just naturally served at room temperature or cold would be a good idea. So there are also some non-food strategies you can try. Now I'd like you to talk to your medical team about this information just to make sure that it's in alignment with the type of treatment you're receiving. So acupuncture and acupressure, there are some studies that say these kind of tools can be useful for nausea. Relaxation techniques can sometimes work. And then using ginger. With this one, ginger is pretty neutral as far as supplements and foods are concerned. However, it can thin the blood. So I would like you to talk to your medical team to see if using ginger is right for you, is right in combination with the drugs that you're receiving, and would work. And a final note about food. So we want you to eat. We want you to stay nourished. And sometimes following very strict diets can get in the way of that. So I would encourage you to relax those restrictions, to allow more foods and more food options into your life right now, certainly right now, to help you stay better nourished. If you'd like to learn more about my nutrition coaching programs, please visit my website at www.cancernutritionsolutions.com. Click on the Work With Me link and check it out. I hope to hear from you soon. Bye now.